Imagine waking up one day and realizing your own brain has just become a completely hostile environment.
Yeah, that's a terrifying thought.
Right. Like you're not just a little anxious, but your mind is violently hijacked by thoughts that are the exact opposite of who you are.
Exactly, and it's so jarring.
It is. Like thoughts so disturbing that you can barely even look your own family in the eye.
Hmm.
You walk around all day assuming your internal monologue belongs solely to you. But, well, what happens when it suddenly turns against you?
It's a reality for so many people.
It really is. So today we're doing a deep dive into a deeply misunderstood condition. We're drawing on some really incredible insights from coping and healing counseling, which is a specialized telehealth therapy practice out of Georgia.
They've provided some fantastic material for us today.
They really have. And our mission today is to unpack this deeply compassionate, honestly life-changing truth about obsessive-compulsive disorder, or OCD. And that truth is this: you are not what your thoughts produce, you are how you respond to them.
That's such a crucial distinction to make.
Okay, let's unpack this, because before we can even begin to talk about how to fix this misfire, we really have to understand the immense, totally invisible burden that someone with OCD is likely carrying right this second.
Yeah, and that invisible burden is precisely what makes this such an agonizing experience.
Yeah.
I mean, it is one of the most profoundly isolating mental health conditions in existence.
Because it's all happening internally. Or...
Exactly. Primarily because the suffering happens in total silence. From the outside, you might look perfectly fine. You're sitting at your desk, you're driving your car, you're eating dinner with your kids.
Right.
But internally, your brain is totally trapped in these catastrophic what-if loops. Like, what if I left the stove on and the house burns down with everyone inside?
Oh, man, just constantly playing on repeat.
Or what if I accidentally swerved my car and hit a pedestrian without even realizing it?
Wow.
And these loops, they don't just pass by like normal worries. They completely hijack entire hours or even days of a person's life.
It just sounds utterly exhausting. When I try to picture what that actually feels like, the standard anxiety comparisons just don't really seem to cut it.
No, they don't at all.
It feels less like a typical worry and more like, well, almost like an autoimmune disease, but of the mind.
That's interesting.
Yeah, like with a physical autoimmune disease, your body's defense system is so aggressive that it gets confused and starts attacking your own healthy tissue to keep you safe.
Right, right.
With OCD, it sounds like your psychological defense system is attacking your own healthy values, like a faulty smoke detector in your house that only you can hear. It's screaming that there's a fire, but when you try to tell people, they just see a normal house.
That is a phenomenal way to visualize it. It's an overzealous defense mechanism. The brain's threat detection system, specifically the amygdala, right, which acts as our primitive alarm bell, it is just firing at full capacity.
So it's literally a physical response happening.
Oh, absolutely. It is flooding the nervous system with adrenaline and cortisol. The alarm is deafening, so the conscious brain assumes, well, there must be a massive fire.
Because why else would the alarm be going off?
Exactly. And because these intrusive thoughts are so distressing and so completely out of character, people internalize them. They feel like these thoughts are undeniable evidence that they are fundamentally damaged or, even evil.
That is just heartbreaking.
It is. And because of that intense shame, this heartbreaking reality exists in the text. Many people carry this agonizing burden for a decade or more before they ever even name it to a professional.
Wait, a decade?
A decade, yes.
10 whole years of thinking you are a terrible person.
Yeah.
I have to push back on that a little, or at least ask for some clarification here.
Sure.
If the internal experience is really as agonizing as you're describing, if it's essentially a psychological autoimmune attack, why on earth would someone suffer in silence for 10 years? I mean, when we're in physical pain, we go to the doctor immediately. Why do they hide it?
Well, this raises an important question. Why the secrecy? And the answer lies in the specific nature of the thoughts the brain decides to broadcast.
Yeah.
People don't hide these thoughts because they are merely annoying. They hide them because they're uniquely horrifying to the person experiencing them.
Oh, I see.
Yeah, people naturally assume that if they have a recurring thought about doing something terrible, there must be some dark, hidden desire deep down inside them that actually wants to do it. But the exact opposite is true.
So they are afraid that if they tell a therapist, hey, I keep picturing myself swerving into oncoming traffic, the therapist is going to think they are secretly a murderer and lock them up.
Exactly. They are terrified of the judgment. But here is the core paradox of intrusive thoughts. And it's arguably the most liberating piece of knowledge we have on this entire topic.
Let's hear it.
The truth that OCD absolutely does not want you to know is that OCD is a disorder of doubt, not a disorder of desire.
A disorder of doubt, not desire. Let's let's really drill down into that because that completely flips the cultural script on how we talk about intrusive thoughts.
It really does change everything.
Right, because we usually treat dark thoughts as suppressed desires, like, oh, you must secretly want that.
Which is a tragic misunderstanding, truly. These intrusive thoughts are just random, meaningless misfires of the brain. Everyone has them, by the way.
Wait, really? Everyone?
Oh, yeah.
Yeah.
But the OCD brain doesn't just let them go. It specifically latches onto the things that would distress you the most.
That's wild.
And it does this precisely because that immense distress signals to the brain, look how much this thought upset us. This must be something incredibly important to defend against.
Wait, I struggle with the idea that the brain would intentionally torment us like that. If it's trying to protect the things we love, why use catastrophic terror?
It's a good question.
Because, like, from an evolutionary standpoint, paralyzing someone with fear doesn't make them a better protector. It makes them completely dysfunctional. So how does that neurobiological misfire actually happen?
Well, it happens because the amygdala, that primitive alarm system we mentioned earlier, is incredibly fast, but it is not very smart.
Okay, so it's fast, but dumb.
Exactly. It cannot tell the difference between a physical threat right in front of you and a conceptual moral threat in your imagination. Let's look at a really painful but very common example from the text.
Yeah, please.
Imagine a highly devoted, loving parent. Suddenly, just out of nowhere, their brain generates a graphic, intrusive thought about causing physical harm to their own baby.
Oh, God.
Right. The parent is instantly horrified, disgusted, terrified. They think, I must be a monster for even thinking this.
Which, I mean, makes sense. That is a completely natural reaction to a horrifying thought.
Right. But neurobiologically, what's actually happening, the reality is that intense horror actually proves they are a loving parent.
Because a monster wouldn't care.
Exactly. If they were truly a monster, the thought wouldn't cause a panic attack. It wouldn't cause a massive spike in cortisol. The brain latched onto that specific thought because the parent's highest, most cherished value is protecting their child.
That is so profound.
The disturbing content is quite literally the negative image, the exact opposite of who the person actually is. And what's fascinating here is that the intense emotional reaction, the distress itself, is the superglue.
The superglue.
Yeah, because the parent reacted with such pure terror, the amygdala logs that thought as a severe, life-threatening danger.
I see. The amygdala is just doing its job. It says, whoa, that thought caused a huge panic response. That thought must be as dangerous as a tiger in the room. I need to keep reminding you about this thought so you stay vigilant.
Precisely. And if the brain thinks there's a tiger in the room, it demands that you take immediate action to neutralize the threat. It demands a behavior to ensure safety.
Here's where it gets really interesting, because that demand for action is what creates the compulsions, right?
Yes.
The ritual.
Yes, exactly.
Like the checking the locks, the excessive hand washing, the mental counting. It feels like the ritual is the solution. You feel the panic, you do the ritual, and you get a temporary hit of relief.
A very temporary hit.
Right, the alarm turns off for a second. But mechanically, doing that ritual is actually a trap.
It is the ultimate trap. When you perform a compulsion, you might feel a temporary drop in anxiety. But biologically, you are not reducing any actual risk, because the risk was only ever a misfiring thought.
Right, there was no actual tiger.
Exactly. What you are actually doing is cementing a very dangerous neural pathway.
You know, I used to hear it described like feeding a stray dog to make it stop barking, but honestly, based on what you're saying about the neurobiology, it sounds more like paying extortion money to a blackmailer.
Oh, I like that analogy.
Yeah, like the thought shows up and threatens you. It
Yeah.
says, you're a bad person, prove to me you're not. So you pay the extortion fee by doing the ritual, you check the stove 10 times, or you mentally repeat a prayer over and over.
It seems to work. Briefly.
Right, the blackmailer goes away for the day. You bought a day of silence. But what did you actually do? You just proved to the blackmailer that you have the funds and that you respond to threats. You've guaranteed they will be back tomorrow asking for more.
That is a brilliant analogy. Every time you perform a compulsion, you are paying the blackmailer. You are validating the brain's false alarm.
You're telling it the alarm was justified.
Yes. You are telling your nervous system, yes, that thought was genuinely as dangerous as a tiger, and it required a physical response from me to survive it. Doing the ritual reinforces the neural pathway that connects that specific thought to mortal danger. which just guarantees the thought returns louder the next time.
Which sounds like a completely inescapable prison. But this is where the science gives us a very clear, heavily researched way out. Let's talk about the mechanics of ERP exposure and response prevention therapy.
ERP is the gold standard evidence-based treatment for this exact cycle. If the ritual is paying the blackmailer, ERP is the incredibly difficult process of letting the blackmailer threaten you, feeling the absolute terror of that threat, and completely refusing to hand over the cash.
Okay, I have to be honest, that sounds like pure torture.
It is not easy, I won't lie.
Just sitting there letting your brain scream at you that you're in danger and actively choosing to do nothing to soothe it, how does that actually heal anyone?
It sounds counterintuitive, and yes, it is very challenging, which is why it requires a highly trained professional to guide the process. But the mechanism behind why it works is beautiful.
Oh, lay on me.
ERP relies on a biological process called habituation, and it physically reshapes the brain through neuroplasticity. Through gradual, structured exposure to the feared thoughts, the patient is asked to experience the anxiety without performing the ritual.
So that's the response prevention part?
Exactly, they are practicing the response prevention.
So they're letting the false alarm blare. They're engaging with the terrifying thought, but they are purposefully using their prefrontal cortex, the logical decision-making part of the brain, to override the amygdala's demand to run away or do a ritual.
Exactly. And over time, something remarkable happens biologically.
What happens?
As you sit with the anxiety without performing the compulsion, the nervous system eventually realizes, wait a minute, I sounded the alarm, the cortisol spiked. But we didn't do the ritual, and nothing bad happened.
Oh, wow.
We didn't die. The child wasn't harmed. Over repeated sessions, the brain physically builds new, stronger neural pathways that inhibit the fear response. The amygdala learns that the thought is just a thought.
It loses its power.
Yes, it loses its emotional charge. Patients who go through ERP successfully often describe a profound, overwhelming relief. Sometimes, it is literally the first true quiet they have experienced in their own minds since the disorder began.
The first quiet they have felt in years. That is so deeply necessary. But, understanding that ERP works is utterly useless if the barrier to entry is too high.
That's the tragic reality for a lot of people.
Right, because if the core symptom of this disorder is crushing, isolating shame, asking someone to drive across town, sit in a public waiting room, and confess their absolute darkest, most horrifying thoughts to a stranger, that is a logistical and psychological nightmare. It's almost perfectly designed to keep people from getting help.
It is a massive roadblock. The sheer logistics of finding specialized care, combined with the shame, keeps people locked in that decade of silence we talked about earlier.
Which is why the practical framework of coping and healing counseling is so fascinating to me. Let's look at how they are structurally set up to dismantle these exact barriers. They are 100% telehealth, fully IPA-compliant practice covering all 159 counties in Georgia.
That geographic reach is absolutely vital. Specialized ERP therapists are usually clustered in major metropolitan areas, leaving rural or suburban populations completely cut off from evidence-based care.
Right, you're just out of luck if you live an hour away.
Exactly. By operating exclusively via telehealth across an entire state, they are completely democratizing access to a life-saving treatment.
So what does this all mean for the actual patient experience?
If we connect this to the bigger picture, the telehealth model isn't just about convenience. It is a clinical necessity for this specific disorder. It directly neutralizes the psychological barrier of shame.
Because you're in your own space.
Yes. You don't have to navigate a waiting room while fighting off a panic attack. You can engage in this highly vulnerable, exhausting work of ERP from the absolute safety of your own living room. You can face the blackmailer in the very environment where you feel the most secure.
That makes total sense. You are stripping away all the unnecessary external stressors so the patient can focus all their energy on the exposure itself. Now, there is another detail in their setup from the source material that I really want to unpack.
Oh, what's that?
Well, they have a team of over 15 licensed therapists, licensed clinical social workers, licensed professional counselors, licensed marriage and family therapists. But it is specifically emphasized that they are a diverse, culturally competent team.
Yes, that's a huge point.
Why is cultural competence specifically highlighted when we're talking about the neurobiology of OCD? Isn't an amygdala misfire the same across the board for everyone?
The neurobiology is the same, but the content of the intrusive thoughts is not. Remember, OCD targets what you value most, And our deepest values are inherently shaped by our culture, our communities, and our religious beliefs.
Okay, I'm tracking.
There is an entire subtype of OCD known as scrupulosity, where the intrusive thoughts focus on religious or moral perfectionism.
Oh, interesting. So instead of worrying about leaving the stove on, the person is terrified they've committed an unpardonable sin, or that they accidentally prayed to the devil, or that they are fundamentally offending God.
Exactly. Now imagine a patient from a very strict, devout religious background sitting down with a standard therapist who lacks cultural competence. The patient confesses that they are having intrusive, blasphemous thoughts during prayer.
Right, that takes so much courage.
It does. And a therapist without that specific cultural lens might misinterpret this as a genuine crisis of faith or religious trauma and try to treat it through traditional talk therapy like trying to logic the patient out of their religious guilt.
Which would be a total disaster, right? Because talking through the logic of an intrusive thought is just another form of a ritual. It's validating the thought as something worth debating.
Precisely. Traditional talk therapy can actually make OCD significantly worse for that exact reason. But a culturally competent ERP therapist understands the context of the patient's values. They can accurately differentiate between a deeply held, beautiful religious belief and an OCD misfire wearing a religious mask.
Oh, that's such a good way to put it. An OCD misfire wearing a mask.
Yeah, they know how to guide that patient through exposure without alienating them from their community or their faith. Being seen accurately by the person trying to heal you is half the battle.
And it's worth mentioning they don't just treat OCD in a vacuum. Their specialties also include anxiety, depression, and trauma or PTSD, which makes total sense because those conditions so frequently travel right alongside chronic OCD.
They absolutely do. Comorbidities are very common.
But I want to pivot to the final roadblock, and it is usually the biggest one, the financial reality. Finding specialized mental health care, especially someone trained specifically in ERP who actually takes insurance, is notoriously difficult. People often end up paying hundreds of dollars completely out of pocket for a single session.
Which just compounds the anxiety.
Right.
If you are already terrified of the treatment itself, adding immense financial strain to the equation is often the breaking point where people just give up entirely.
What makes the coping and healing model so disruptive here is that they've aggressively removed that roadblock. Their financial structure is incredibly accessible. Like, if a patient has Medicaid, their copay is literally $0.
That's practically unheard of for this level of care.
Right. A $0 copay for specialized, life-changing ERP therapy. And they also accept major commercial insurances. Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. Sessions typically end up costing the patient between $35 and $40.
That level of financial accessibility for specialized care is rare, and it really changes the entire clinical equation. ERP is a process. It requires consistent, repeated sessions to successfully retrain the nervous system and build those new neural pathways.
You can't just do it once and be cured.
Exactly. By removing the stress of affording the next session, the patient can dedicate all their cognitive resources to the difficult work of habituation.
They are essentially removing every single excuse the OCD tries to use to keep you isolated. You don't have to drive anywhere, you don't have to explain your culture from scratch, and you don't have to empty your bank account.
They've made it as simple as possible.
The very first step is practically frictionless. You can literally just take a free 2-minute OCD screen right on their website at cheechtherapy.com/mental health tests. Or if you just want to talk to a human being to get the process started, you can call them at 404-832-0102.
A 2-minute screening is all it takes to start starving the blackmailer. It is the first step toward reclaiming your own mind.
It really is. Unpacking this has been an incredibly profound journey today. I think the ultimate empowering takeaway for anyone listening, whether you are dealing with this yourself or you recognize these silent struggles in someone you love, is exactly what we established at the start.
Absolutely.
You are not what OCD tells you. You are not the terrible, horrifying things your brain flashes in front of your eyes. You are just someone whose threat detection system is firing a little too aggressively. You have an autoimmune condition of the mind. And most importantly, you do not have to keep suffering in silence for another decade, because genuine, evidence-based help is waiting.
That's the most important message.
Just a final reminder, if you are in Georgia and need that help, reach out to Coping and Healing Counseling at atechuptherapy.com or call 404-832-0102.
As we wrap up our analysis of this material, I'd like to offer one final thought to reflect on, building on the paradox of doubt versus desire we talked about.
Oh, I'd love to hear it.
Well, if the darkest, most distressing thoughts produced by an OCD misfire are actually just a negative image reflection of a person's deepest, most loving values? What might our own everyday run-of-the-mill anxieties be trying to tell us about what we secretly cherish the most?
Wow, that is a beautiful question and definitely something to sit with. Thank you so much for joining us on this deep dive. Take care of yourselves, and we'll catch you next time.